Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Hema, who did her MBBS from KIMS, Bengaluru, and then did her MD and also the fellowship in perinatal medicine from St. John's Hospital. And she's an expert in taking care of extremely preterm, very small babies and managing with birth asphyxia as well as pulmonary hypertension. Now she's working in Natus Women and Child Hospital, Mysore Road, Bangalore. Welcome, Dr. Hema. You know, summer has set in and people are thirsty, and especially the children, when they run and play, they want to eat and they want to drink something, and ultimately they fall sick. As you know that in your OPD, 20% of more patients are coming with the vomiting and diarrhea and what we call gastroenteritis. So please tell us what is this gastroenteritis and how the parents have to take care.
So, as per the definition, diarrhea means more than 3 episodes per day and change in the stool consistency. It can be loose stools or the vomiting episodes. It can be associated with fever or may not be associated with the fever. So, why there is increase in the cases because of the summer season, which is favorable for the bacterial multiplication. Food gets spoiled early, so consumption of these is causing the more diarrheal cases currently in Bangalore.
Okay.
Yeah.
Now, what are the types of diarrhea or gastroenteritis?
See, it can be the secretory diarrhea or the infective diarrhea. So, in the infective diarrhea, we have the causative agents, bacterial, viral, and parasitic. So, under the bacterial, we see commonly E. coli bacteria, Shigella, Vibrio cholera. So, in the viral, we have the adenovirus.
No, Vibrio cholera also is viral, no?
Yeah.
Yeah. Typhoid is the bacterial, but as Vibrio
Bacteria,
cholera is,
typhoid,
yeah.
yeah.
Okay.
Yeah.
Okay.
So in the virus, we have the
Rotavirus.
adenovirus, rotavirus, Norvac virus group of viruses. Parasitic Giardia we commonly see in that. So in the other like secretory diarrhea in the non-infective, the causes will vary, which is currently we are focusing on the infective causes in the summer season. Yeah.
Okay. Now you said that the children are being more affected. What is the cause and what is the food that is which they're consuming, and as a result they're coming with the vomiting and diarrhea?
Okay. See, the food can be it can be the food consumption or the contaminated water consumption. So either of it is most commonly we see in our regular day practice. So they'll have the junk food outside, for example, the cake or the pastries. So they get spoiled early, and it has a favorable temperature which is favorable for the bacterial multiplication. So we don't know when we buy from the outside when it is prepared.
When it
All
was
that.
prepared and what it
Yeah.
is, because it is not
Yeah.
okay. And also
Yeah.
the ice cream also can cause, not only sore throat, they can have the bacterial infection
Yeah.
also. Yes.
Yeah. So, and proper consumption of hygienic water is also sanitation, hand washing, regular hand washing when the children don't
Very
do.
important, very important, because nowadays the people have forgotten the importance of hand wash. When the
Yeah.
corona
Yeah.
was there, they were washing, but
Yeah.
now they have again forgotten. And
Mhm.
especially for children, by
Yeah.
just hand wash itself, 50% of this gastroenteritis can be reduced. And also by not eating the what to say, the food that is stale and kept for a long time.
Yeah.
Okay. Okay.
So
Now, what are the
these are the
symptoms? Yeah.
So symptoms will vary with no dehydration, some dehydration, severe dehydration. So in the no dehydration, the children will be alert, they will be thirsty, they'll be vigorously taking the water. Urine output won't reduce so in the initial stages.
Okay.
Whereas in the some dehydration, the
Hmm.
skin turgor will be slightly prolonged, but still the
Hmm.
child will be alert and taking the fluids vigorously. Urine
Hmm.
output will be reduced compared to the normal days. In the severe
Okay.
dehydration, they will be lethargy, they will be semi-conscious, pulses will be very feeble. The skin turgor, whenever we feel it, will be more
I know
prolonged,
when
and
we
urine
pull it,
output
will
will be
yeah.
reduced. The
Yes,
common
yes.
mistake here is they don't parents don't see the urine output because they would have put the diaper. It will be mixed
Diaper,
with
they
the
can't
food.
make out. Yes, yes.
They they'll be having no clue about the urine output
Hmm. Hmm.
when they come in that stage. Yeah,
Okay, okay.
and
And
when they
what
were
is this abdominal flu?
so abdominal flu is more commonly caused by the Norvac virus. Even
Hmm.
they will be having the symptoms like diarrhea, vomiting, abdominal distension with fever,
Hmm.
lethargy. So the treatment is very simple: hydration, no need of antibiotics for this
Okay,
category.
okay, okay.
Yeah,
Because it is a viral one.
viral.
Now,
Yes, it's a
now
viral.
for before we go for treatment, can we talk about the prevention? How it can be
Mm.
prevented?
So mainly with the
The
hygiene,
vaccine.
proper
Yeah.
proper hydration in the
Hmm.
summer season, hand washing regularly,
Hmm.
avoiding the outside food, water purification,
Hmm.
and vaccine. Most important thing is get your flu vaccine, typhoid vaccine, rotavirus vaccine on time.
Okay, okay. Now
Yeah.
all the three vaccines are available, so no need to fall sick and no need to get worried about the child, because gone are the days when we used to lose the patients, the children, because of the
Yes.
rotavirus, but then we didn't have the vaccine. Now that the vaccine has come, the parents should realize that vaccine to be given before the summer sets in so that they have the immunity once the summer comes. So rightly you mentioned that the water has to be pure and the hands must be washed. And now that they have not done and now the child is suffering, now how do you treat the patient?
So we treat based on the severity. When
Hmm.
with the initial phase, no dehydration, where we ask them to drink ORS, plain water, and we monitor. We explain
Hmm.
the danger signs to the mother.
Hmm. Hmm.
And second, some dehydration, we give the calculated amount based on the weight and the age of the baby to drink this much
Hmm.
ORS for every stool output. They should be able
No,
to
you are
be.
talking about ORS, but what about the
Yes.
tender coconut, which is easily available in our country?
Yes, the green tender coconut water. Yes, it
Hmm.
is easily available along with the
Hmm.
buttermilk, the rice kanji. So all
Hmm.
these they can be taken homemade fluids.
Yeah.
So then along with that, ORS is also important. For every stool output, they should replace it. Then for the
Okay.
severe one, suppose in some dehydration, most due to the vomiting, they won't be able to take. We insert NG tube and we try to give them through the
Hmm.
NG tube. And in
Hmm.
severe, yes,
NG
intravenous
tube
fluid
is the
administration.
gastric tube,
Nasogastric
through
tube
the nose
insert.
it is put inside.
Yes.
Okay. Hmm.
So we calculated the amount and we give it based
Okay.
on the weight and the age.
Hmm. Hmm. Hmm.
And severe dehydration needs admission and intravenous fluids mandatorily.
Okay, okay. And now, what about the antibiotics nowadays, or the stopping the loose motions, the tablets? Are they used or not used?
If there is evidence of infection in our
Hmm.
blood reports, if there's any co-infection of Shigella, see,
Hmm.
sometimes there will be even dysentery which develops on day three, on day two. That
Hmm.
dysentery means blood in stools. Yes, that
Stools.
means it's a bacterial infection. In those
Hmm.
scenarios, we have to add antibiotics where there is evidence of bacterial infection. If it is viral infection, there is no role of antibiotics.
Hmm.
And
But if there is
uh,
amoebiasis, then also they can have mucus and the blood in the stools, no?
yes, they
That is
can
not
have.
bacterial, but it is yeah,
Yes,
parasitic. Yeah.
yes, yes. So that helps. We can do the stool routine and we can
Examination.
differentiate
Yeah, yeah.
actually.
Stool
So in
examination will tell you.
stool
Okay.
examination, we can differentiate in that.
Hmm.
So that is the so
Hmm.
in severe IV electrolyte should be electrolyte imbalance. We need to prevent. IV intravenous fluids is mandatory because there'll be
Okay.
more prone for hyponatremia, all those issues.
Yeah, correct. And all of them can lead to complications, and many a
Yes,
times now, if proper treatment is not given, it can lead to death also. And the
yes,
fatal the cases are reported, and hence one has to be very, very careful.
yeah.
So ultimately, if you want to advise the parents, 1, 2, 3, 4, what are the things you tell them in order?
Okay. So the first thing is hygiene, hand washing, homemade food preferably. Second, vaccination. Get you need to go to your meet your pediatrician even when the child is well. Don't go only when the child is sick. So get the vaccination done. You can prevent the illness. Third thing, ORS. Go for the low osmolarity ORS, because don't go for this Tetra Pak ORS. They'll have the higher dextrose, which doesn't help much in the hydration. And the fourth thing is always, whatever the doctor says, what are the danger signs to be monitored, please monitor that at home, and maintain the good nutrition for the
Okay.
babies. Get the anthropometry checked well at regular intervals.
Okay. And
Ma'am,
finally,
and
yeah, yeah,
one more thing, we have seen the
yeah.
people giving loperamide, that is anti-motility drug for the babies,
Yes,
bringing,
yes.
which is
Mm.
easily available in the pharmacy. Any loose stools, they put that, but that is very harmful. The anti-motility, it reduces the stasis, but it is giving more time for the harmful bacteria to multiply in the abdomen.
Oh,
So they come with the abdominal distension.
oh,
So please avoid giving anti-motility drugs in the acute diarrhea cases. So
okay.
this is easily available in the pharmacy, so they're
No,
bringing, which is not advised.
this is a very important point you have raised, because any loose motion, the parents are scared of the loose motion. They want the loose motion to stop.
Yes,
So in their
yes,
anxiety, they give this loperamide or any drug to reduce the motility. But in the bargain, the infection will become more. So
yes,
that parent should realize. So that's a
yes.
very, very important and pertinent question you have raised. And so in the summer, thank you very much for informing the ABCD of hygiene. One, the oral hygiene, next the hand hygiene, next the water. And there was a time when the India used to spend 19,995 crores for only water contaminated diseases. But today, thanks to the tap water in every house, which is chlorinated, the number has come down. But the children going for the junk food, eating the stale food, and that has to be prevented by the parents. And prepare the whatever thing, no, that the lemonade or whatever it is, prepare at home rather than going for the juices that is outside, that sugary syrup, which is again not correct, and that can be contaminated too. So thank you very much, Hema, for informing so well to our viewers. Thank you.
Thank you so much, ma'am. Thank you.